This is Focus on Your Health. I'm T.G. Lafredo, and if you're just joining me, you're right on time to hear from Dr. Michael Payne. He is a radiation oncologist at KRMC, and we're talking about cancer treatment, prevention, and the latest technology. I wanted to begin, Dr. Payne, kind of looking back to our first conversation, and that was September of 2020. And I want to play you a little clip. When we first met, I asked you what you hope to bring to the cancer program, and here's what you had to say then.
Dr. Rivera has a great medical oncology program here, and that most patients don't need to go to Phoenix or Las Vegas to get world-class treatment because they can get it here in Kingman. And that's where I want to bring the radiation program as well, where you don't have to go to Phoenix or Las Vegas or California or whatever to get world-class treatment. You can get it right here at home. And in doing that, I'm introducing stereotactic radiation treatments, which you can get in Las Vegas or Phoenix, but why not stay home and get it?
Yeah.
I also want to look at doing a brachytherapy program with a brachytherapy is a procedure where you place radiation directly into the cancer, and it's helpful for some cancers. And right now, our patients have to go to Phoenix or Las Vegas to get that portion of the treatment done. I would love for them to stay home and get that done. And I'm always looking at ways to expand our technology. There's a new breast treatment that we hope to be doing soon called prone breast treatment. Right now, our ladies are treated, their breast cancers are treated where they land on their back. If they land on their stomach, there's some physics that help pull the breast away from the chest wall, and so the patient gets less radiation dose inside their body while still doing the same job for treating the breast. And so we're looking at doing that as well. So I'm always looking at improving and bringing technologies here for our patients.
So, Dr. Payne, 2.5 years later, as you listen to that, how has it been? Have we been able to make these things happen? Let's talk first about stereotactic radiation.
Yes, we have. We are doing stereotactic radiation on a regular basis right now. We treat a number of cancers with stereotactic, but we mainly focus on prostate cancer, lung cancer, and intracranial or brain tumors. It's a very good program in that it allows us to give really effective doses of radiation to the patient and very few number of treatments. Stereotactic radiation is just very focused, high-dose radiation. The doses of radiation that we do for that are much higher, on the order of anywhere from 8 to 20 times higher than our normal radiation dose per day. The way we get away with doing that is that our machines are so much more conformal. The machines can give that much dose to the tumor while sparing the surrounding areas. Mm-hmm. The benefit of that is that that high dose of radiation kills basically anything that's within that scope, including a tumor. So it's a much more effective way of killing tumor. The benefit for the patient is that instead of getting weeks and weeks of radiation, the radiation is usually 5 treatments or less. And patients love that because patients who travel long distances don't have to come every day, Monday through Friday, for weeks to get radiation treatment.
Yeah. Are there side effects to those intense? Well, of course there are side effects for cancer treatment, right?
Yes.
But those intense doses, does that change the scope of the side effects?
The good news is that the side effects are very similar to the side effects that you would get for the longer course radiation. And sometimes patients actually have better side effect profile, meaning they don't get as many side effects as they do with the longer course radiation.
And this is now possible because the technology is so much more precise than it was maybe even not that long ago?
Exactly. This is now possible because we call our machines linear accelerators. Our linear accelerators are very much more precise than they used to be. And we use a lot more scans than we used to use. We use MRIs, we use PET scans and CT scans to determine how the radiation goes in and what it should treat and what it should avoid.
So you can really be a marksman on this and
yes,
get exactly
what you
right.
need.
That's very interesting. And so tell me again which cancers we're using to address.
So right now, mostly prostate, lung, and brain tumors. We are expanding that out to include other tumors, but for right now, that's mainly what we're doing. And like I said, patients, since there are so few treatments, we're getting patients from further and further away that we would not have gotten before.
Yeah, there's a little dab of irony in there because part of getting this technology here was that we didn't want our local patients to have to travel so far to get those treatments. And now you have patients coming from afar to get treatment here.
That's correct.
That's a sign that you're doing something right.
Yes,
Yeah.
It is.
Another one of your goals when you first began here was prone breast treatment. Can you talk a little bit about what that is?
Yes. So prone breast, the way we traditionally treated patients with breast cancer is we would lay the patient on their back, and we would the radiation machine would treat them laying on their back with supine. When you lay a woman under her back, the breast kind of hangs over the chest wall.
Sure.
And so when the breast hangs over the chest wall, especially in larger breasted women, we have to include more chest wall and more normal structures to treat the breast cancer. And when you include more normal structures in what you're treating, there's an increased chance of side effects. So a technique was developed to reduce the amount of normal tissue that's in the field. And the way they do that is instead of laying the patient on their backs, we flip them over and lay them on their stomachs. And our table has a hole in it, and the breast hangs through the hole. So everything above the hole, the rest of the body, gets very little radiation. Everything below the hole gets the dose that we are aiming to give. And so that benefits the patient in that she gets much less radiation to her chest wall, or potentially much less radiation to her chest wall, which includes her lungs, her heart, esophagus, things like that. Everything else is the same except for the lower dose to the chest wall structures. And I do that now for every breast patient except for women who can't tolerate lying on their stomachs.
And Dr. Payne, also kind of on your wish list when you began here, you were talking about brachytherapy. What is that, and how is that going?
So brachytherapy is putting the radiation in directly adjacent to the tumor. And so right now, most of the radiation is done by an external machine, meaning an X-ray machine that gives X-rays that is external to the patient. Brachytherapy allows us to treat or give higher doses to tumors by putting the radiation directly into the patient. The way we do that is we put catheters or cylinders into or directly adjacent to the tumor, and there's a machine that has a radioactive source that sends that source through those needles or through that cylinder, and it gives radiation from the inside out, basically. Yeah. The benefit of that is that it has a number of benefits in certain types of cancers. One is gynecological cancers, where you can put a cylinder inside the woman and the radiation goes in and treats her from the inside out. And the benefit of that is it reduces the doses that we give to the bladder or rectum and in normal structures.
Right. And we're not quite there yet with...
We are not quite there. The program is all drawn up and it's planned.
Yeah.
Right now, we're just waiting to see the direction of where the hospital is going.
Yeah. That's something to be hopeful for the future. Dr. Payne, I recently received a press release about how the Cancer Center has begun using a PSMA PET scan to detect prostate cancer. I'm going to need a little help here with my terminology. What is this, and how does it work?
Okay, so a PET scan is a positron emission tomography. And all that means is that it picks up cells that are active.
Okay.
So basically, the patient gets a radioactive injection of usually a radioactive sugar, but it can be other molecules. And that is picked up by cells that are active. Usually the most active cells in your body are going to be cancer cells. There are some cancers where they're not very active, so they don't pick up a lot of that. And so we had to come up with different other molecules to inject that would pick up those other types of cancers. And prostate cancer is one of them. Prostate cancer usually doesn't show up on a regular PET scan. And so they develop a specific prostate molecule that they can inject that goes to prostate cancer so we can see prostate cancer on a PET scan. That molecule is called a prostate-specific membrane antigen.
Okay.
And it's just something that they inject and it goes to prostate cancer cells. They do a scan to find out where the injection went, and they can find out where the prostate cancer is.
What is the significance of this technology for KRMC and the community?
That's a great question. So this, like I said before, when we do regular PET scans for other types of cancers, and when we do them for prostate cancers, it doesn't always pick up the prostate cancer. Now we have a technology that we can discover prostate cancer, either cancer that's spread outside of the prostate area, which is basically what we're looking for, or we can actually see the cancer in the prostate now. The benefit for the patient is we can use it as a staging tool that tells us whether the prostate cancer is metastasized outside the prostate area or not. And that helps with the patient's treatments and treatment options.
And this is technology also that brings KRMC probably to a different level.
It does. We are the first hospital in Mojave County to get this technology, and it definitely helps for our prostate cancer patients because before I had to send patients to Las Vegas or Phoenix to get the scan done.
Let's talk a little bit about the importance of cancer screening. We've been doing cancer screening for a long time for certain cancers. I'm going to have you catch me on this. I know for sure breast cancer screening.
Yes.
And I'm aware also that, and that's like at KRMC, we have the Catch It Early program.
Yes.
And we reach out to try to make sure women are getting their annual screening mammograms.
Yes.
Also, I know that Dr. Adam Braze is involved in a lung cancer screening program.
That's correct.
And what else? What am I forgetting?
And we have prostate cancer screening, and we have colorectal cancer screening.
Can we talk a little bit about the importance of screening?
Screening is important because there are a number of studies that have done that demonstrate that if you catch cancer at earlier stages, you have a better chance of defeating it. And what screening does is allows us to catch cancer early at earlier stages, so we have better and more treatment options for the patient.
These screenings and these tests are important everywhere, but I also know that in Mojave County we have exceptionally high rates of cancer.
Yes, our cancer incidence is higher than other similar counties, and the reason for that is there are many reasons, but two of the bigger reasons are that one, we have an older population, and the older you get, the higher chance you have of developing cancer.
Sure.
And the second is that we have a higher incidence of smoking in the county, and it's well known that smoking causes multiple cancers.
Yeah.
The great news is that smoking is down everywhere. I mean, this county, the country, the world, because we know that it leads to multiple types of cancers. The bad news is that people are still smoking.
For sure. So we just keep fighting the good fight.
So we just keep fighting the good fight. The best we can do is educate people and try to help people quit.
Yeah.
Because it is a very difficult thing to stop doing.
That is Dr. Michael Payne. He is a radiation oncologist here at KRMC. Dr. Payne, thank you so much.
Oh, thank you. I appreciate it.
And that is the program. That's Focus on Your Health. I'm T.G. Lafredo, and thank you for listening. Stay healthy, and we'll catch you next time.